Hey guys, welcome to the Madison and Hannah Show. Today we will be demonstrating how to don and doff personal protective equipment, also known as PPEs.
This procedure will be done when entering a buffer area in a pharmacy setting. A buffer area is kept sterile at all times and is used for sterile compounding.
Before entering the buffer area, there are a few guidelines. First, make sure you take off all outer garments. Step 2. Remove all makeup. Step 3. Remove any jewelry. Absolutely no fake nails. Now we are going to begin donning PPEs. It is pertinent that these are done in the correct order. The first step is to put on your shoe covers. Now that you have your shoe covers on, put your hairnet on. This is important to do because it will prevent hair from falling into the sterile field. At this time, place your face masks on. It is important to cover your nose and your mouth thoroughly. Your top 2 strings should be tied at the top of your head, and the bottom 2 strings tied at the back of your neck. Next step is your face shield or goggles. This will prevent any spills or splashes getting into your eyes during sterile compounding. The last step is to put your gown on. This is important to prevent any spills from getting on your clothing. After you step into the buffer zone, you will begin to wash your hands with surgical scrub. This is to free as many microorganisms as you can. After washing your hands with surgical scrub, you will then put on your disposable gloves. After your disposable gloves, you will put on your sterile gloves. It is important to double glove because it will prevent contamination. When putting your gloves on, it is important to cover the cuffs of your gown. Now that you have done your sterile compounding, it is time to take off your PPEs, also known as doffing. The first thing you will take off is your outer pair of gloves. It is important to not take off your inner gloves. This will come at a later time. After removing your outer pair of gloves, you will then remove your goggles and then your gown. When removing your gown, roll it away from you. This prevents contaminants from getting on your clothing. Next, you will remove your mask, followed by your hairnet. At this point, you will remove your shoe covers, and then you will remove your inner pair of gloves lastly.